move over into the camera a little bit. I think we're a little better now. Hello, everyone. Thank you for joining us today. My name is Alberto Villafan. I'm the digital producer at Sahan Journal, and this afternoon we are discussing recent changes to Medicaid and MinnesotaCare and its impacts on Minnesota's immigrant communities. I'm joined by two guests today that can help us dissect all the recent changes and how it impacts you and your neighborhoods. I'm going to let them introduce themselves. Dr. Tromilo, would you like to go first?
Yeah, sure. Thanks, Alberto. So my name is Dr. Nathan Chomolo. I'm a pediatrician and internist, and I practice pediatrics in Brooklyn Center. But most of my time is now spent as the Medicaid medical director for the Department of Human Services. I've been in that role since 2020. Great time to start state government right before a pandemic. But I came to the role to really center community, work on how we can improve delivery and access to our Medicaid program, knowing that health and health insurance is such a key part of us living and thriving the way we want to and the way we deserve. So happy to be here and talk. Maybe not happy is not the right word, given some of the context, but I think it's appreciate the space to talk about what's facing our state and our communities when it comes to healthcare and Medicaid.
Thank you so much for joining us, Doctor. All right, next over here, I've got Ryan. Why don't you say hi and introduce yourself?
Hi, my name is Ryan Perez. My role is I'm the director of organizing at COPAL. COPAL is a movement organization of members who are committed to improving the quality of life of Latinos across the state of Minnesota. COPAL has offices in Mankato and Rochester and in Minneapolis. And my day-to-day, my focus is on membership, building a strong membership, making sure our community is informed and ready to act on issues that matter. And so it's a pleasure and an honor to share the space with Dr. Chamano. And I think we'll have a really awesome conversation. It's a lot to unpack, but here we are.
All right, thank you both so much for joining us. Real quick, Ryan, do you mind just sitting a little closer to the mic?
Oh, sure. Yeah.
Thank you. That's much better. All right. First things first, Doctor, I'm sure everyone has a million questions on what the heck is going on, but let's just lay down some groundwork. Real quick, can you just define what Medicaid is and what it typically covers?
Yeah, and I've actually learned that it's real important to start there because our healthcare system is so complex that a lot of times I'll be, well into a presentation and someone asks me a question about Medicare, right? And so I usually start with that, distinction. So Medicare is a federal health insurance program for our elders 65 and up, and you are eligible for it just on basis of residency and age. Some people do get eligibility based off of certain medical conditions and disability statuses, but it's primarily based off of age. So Medicaid, what we're going to spend most of our time here today, that is a state and federal program that's about to celebrate its 60th birthday next week, actually. And so over those 60 years, there's been a lot of adjustments to it. And it started as, really intended to help the most needy, folks with low incomes who couldn't access health insurance or health care because they didn't have it through their jobs or didn't make enough money. And it's continued to evolve with, really thoughtful improvements from multiple spectrums of the political aisle and in multiple corners of our communities. But it is that kind of state and federal program for folks in need. And so, the state has a say and the federal government has a say. They both pay into it. And that then provides insurance for so many people. And in Minnesota, we know that, roughly about 20 to 25% of Minnesotans get their health insurance through Medicaid. But that number varies based off of things like age. So we know that our children, anywhere from kind of 60% of our Black and American Indian children, 40% of our children who identify as Hispanic, get their coverage through Medicaid. We know that birthing persons and pregnant women, upwards of 70 to 80% of our Black and Indigenous birthing persons get their coverage, through Medicaid. And then folks who live with disabilities and navigating worlds with disabilities, they often get their coverage or some of their healthcare coverage through Medicaid as well. In addition to even our elders who might get care through Medicare, there's still gaps, and Medicaid picks up those gaps for elders as well, including things like long-term care. And so it really is a vital part of our healthcare system across Minnesota.
Thank you so much, Doctor. That was a lot of information. Throughout this show, we're going to be fielding questions from our audience as well. So if you have any questions, comments, or concerns, anything you would like either of our guests to clear up for you, feel free to drop those comments into the chat. I will be asking them throughout the show, and we'll hopefully get to as many as possible. But as Dr. Tremillo has thankfully shown, this is a complex system. It's not going to be very easy to get through everything, but we'll do the best that we can. All right, real quick follow-up. We have seen some significant cuts to Medicaid. As simply as possible, if that's possible, could you help our audience understand what the cuts mean for Minnesotans?
Yeah, so we talked about Medicaid being both a state and federal program, and that historically there's been a federal level of commitment and a state level of commitment to funding the program and making sure it takes care of the folks in our state. And quite frankly, the federal government is backing away from things that they've historically been committed to supporting, and so they are putting policies into place that will make it harder for folks to get access to Medicaid. It will make it harder for folks who are currently on Medicaid to stay enrolled in Medicaid. It will decrease payment, their portion of payment for certain parts of Medicaid. And so the net result is that more Minnesotans will go without health insurance as a result of the passage of this bill. Kaiser Family Foundation, independent health policy researcher and outlet, they are estimating somewhere in the realm of 140,000 Minnesotans. We're currently still doing our own estimates based off of that, but that's a lot of Minnesotans. That's a whole city's worth of folks who aren't going to have access to coverage going forward. And then one thing real important to note is that because Medicaid is such a big part of our healthcare system, that means there's a lot of providers. There's a lot of clinics, a lot of hospital systems, both in the Twin Cities and in greater Minnesota, who a lot of their patients get their coverage through Medicaid. And if they lose that, they'll likely still be providing some levels of care, but they won't get paid. And that's going to impact their ability to stay open, their ability to provide a huge scope of services. And so really in the end, we are all, paying a price here. We're all potentially going to have a weaker system because of these cuts to Medicaid.
Thank you, Doctor. Nate. Sorry. Ryan, you're the organizing director at COPAL, Comunidades Organización El Poder y Acción Latina, my bad. I have dyslexia. I don't know how to read. COPAL is a Latino advocacy agency in Minnesota. Your organization is concerned about these cuts to Medicaid, yeah?
Definitely concerned. Let me start off by saying that I firmly believe healthcare is a human right. And COPAL believes healthcare is a right, and COPAL has a core value on our legislative platform, which is built by members, by the community, to expand access to healthcare for everybody. And with that, we know that healthcare as a right is being under attack, not just from cuts in Medicaid, but through a whole barrage of changes that are coming our way. For one, MinnesotaCare access is being taken away from undocumented adults here in Minnesota. Another is obviously the cuts to Medicaid that we're talking about, the cuts to SNAP as well. And then, of course, at the federal level, eligibility for access to the Affordable Care Act marketplace for documented immigrants is also being taken away for many documented immigrants. And so this slew of changes is affecting immigrants of many different statuses. It's affecting people of color primarily. It's affecting working people primarily. And so these are really concerning changes, and we have to have a community response. One piece is community education, which is making sure our members who are impacted by these changes are informed about them. But another is an organizing response and making sure that we're not going to let these changes go unnoticed or without a voice of response from the community.
Later on in the show, we're going to touch on how COPAL is going to help, or is trying to help people receive healthcare services and what actions they're putting forward. But moving along, getting some more groundwork down for everyone here. The nonpartisan Congressional Budget Office reports that the legislation includes more than $1 trillion, trillion with a T, in cuts to Medicaid in the United States. Since Medicaid is funded by both the federal government and states, Dr. Tromolo, how much could this cut from funding to Minnesota?
Yeah, so that estimate, just for perspective, is over 10 years, right? And so it's a trillion, a little over a trillion over 10 years. And, some of the kind of initial analysis, we haven't been able to get through all of the different provisions. It's a long bill. But, some of the initial analysis, looks at some of the provisions like enforcing work requirements, right? This is the idea that while you're on Medicaid, if you're an adult without children, covered under expansion, you're going to have to document, and we have to set up as a state and with our county partners as well, because the state funds it, but it's county administered, and they're real crucial partners in the Medicaid program as well. We have to figure out a way to then track that, right? And we don't currently do that, so we're going to have to spend money to create a system to do that. And so just for creating the system alone, we're going to have to find the estimates are roughly $165 million more a year to implement work requirements. And then the potential losses. And so what we know is that there's been states like Georgia and states like Arkansas where they've done work requirements, and people who are eligible, who are working, lose coverage because of the systems in place. And so the loss of coverage is estimated another about $200 million less of federal funding and support towards our Medicaid program that will be coming in. And again, that while that doesn't necessarily go right into the state's bottom line, our healthcare providers will feel that really acutely as well. And so just that from that one provision, you're looking at over $300 million that we have to make up somehow, or find ways to meet from this bill in trying to deliver healthcare for all Minnesotans.
So when we talk about these cuts affecting a lot of people, I'm curious. How will we often talk about like Twin Cities? A lot of our coverage is focused on like Twin Cities. That's where a lot of people are in Minnesota. But how could these cuts be affecting people in rural Minnesota, like Mankato, Northeast Minnesota, et cetera?
Yes, so we actually put on a lot of good infographics on Medicaid Matters. So if you just Google Minnesota DHS Medicaid Matters, you can see the breakdown of who's covered in our communities across the state. And in fact, if you live outside of the Twin Cities, almost just around half of our enrollees across the state live outside of the Twin Cities area. And just based on percentages, you're actually more likely to have a neighbor or a friend or a family member that is covered by Medicaid if you live in places like Northwest and Southwest Minnesota. And so, that's a big impact right there to individuals and families. And then again, I'm going to keep, bringing this up, the healthcare system itself, like the clinics and hospitals. We know, for example, in states that haven't expanded Medicaid through the Affordable Care Act, that they've had more rural health hospital closures because the costs of providing care for folks who don't have insurance add up over time and provide strains, or they start reducing services like OB services, so that you have to then, as a mother, a father expecting your child, drive over 2 hours, to get to the care you need. And so those are some of the challenges that we, are really worried about seeing be replicated here because of this bill.
Just want to jump on some of the points made by Dr. Chamalo, but about this piece about adding requirements and adding a bureaucracy layer, is that our community has a problem enough, a challenge enough, accessing these programs, completing the paperwork. I was, the one in my family growing up that was doing the taxes, doing the paperwork, signing all the forms, and there are literacy barriers and there are understanding barriers, and there's language access. And that is even more felt in Greater Minnesota. In Greater Minnesota, in many towns, if you're a Spanish speaker, your language resource is your pastor, who is a Spanish speaker, and who it helps you navigate. And that might be your only resource. That's why COBAL set up offices in Mankato and Rochester, serving about 20 counties, because there's just so much lack of resources once you break down by language. And so we're really concerned, and we know that a lot of investment is going to be needed. And so, one thing is all the state systems that need to change, and then also the educational investment that's going to have to come from state, from philanthropy, from community, and it's going to be a lot of work ahead.
And that's only 2 areas that are actually being reached by your services. That doesn't even speak to people that are in, like you were saying, Northwest Minnesota, much more secluded, and odds are a bit more of a desert, I assume, in terms of healthcare. Yeah.
There's actually a good amount of healthcare facilities in Northwest Minnesota, but I think the point that Ryan is making is something that we've seen throughout the response to the COVID-19 pandemic, right? And how important it is to have community based organizations, community messengers to connect with folks and help them understand. Before this bill, we just got done with a big effort to re-enroll everyone in Medicaid because during the emergency response to COVID-19, folks just stayed on. We didn't ask them to redetermine or submit paperwork to stay on and continue to get their health insurance through Medicaid. That changed in 2023. And so we tried to take some of those lessons from COVID and really work with folks like Gopal and others to get the message out that this is happening. Here's how you navigate it. Here's the resources. And we were really successful in both working alongside them, hearing what was working and what wasn't, and making those internal changes. And over the course of our campaign, we went from about 40% of folks not successfully going through the redetermination process to down to like 15%. And so we'll lean into those lessons learned, but it is kind of frustrating when we've done such great work to keep people connected that now then we have to shift in such a way and put up more barriers when we know that keeps people from care and keeps people from being healthy and thriving.
Thank you both for that follow-up. I really appreciate you guys. Thank you so much to everyone listening right now. If you are just now joining us, we are talking. First of all, hi, my name is Alberto. We are talking about Medicaid changes with Ryan Perez, Organizing Director at Copal, Minnesota, and Dr. Nathan Chomelo, Medical Director for the State of Minnesota's Medicaid and MinnesotaCare programs. If you have questions regarding these cuts if you have questions regarding these cuts for our guests, be sure to ask your questions in the chat. Moving along, Ryan, Copal serves a lot of Latino immigrants. Have you heard concerns from Latino immigrants regarding these cuts to Medicaid?
There's a lot of questions about what's happening, but I will just say the overwhelming thing is people not knowing that any laws have passed, that any changes are coming down. And so as much as we and this audience probably know about the big ugly bill and all the impacts of the new federal law and some of the state legislation that has passed, overwhelmingly our community still needs to be at the basic level of understanding what does this legislation pass, what does it do, and then also when people have really complex family situations, immigration status, different pieces, are they individually affected as well? So I would say the biggest problem is not hearing enough from the community because people don't know that this is all happening, and we just need to have those intentional conversations. One thing is, again, through Copal's committees, we have about 150 leaders that are participating in different committees, and they're having these conversations right now. And also, how do we get that information to our neighbors?
And what are you frequently telling these people? I assume you're just breaking the news to them that they're losing coverage.
We need to start with breaking down the key components of legislation that are happening and how they're affected. But really, it's a lot deeper, and an individual's case and situation can take a long time to figure out and take a lot of information and resources. And so we have our health navigators that you can call our phone number. It's on our website, and they're in Spanish and English, and they'll consult and do research on someone's individual situation. We also have a health promoters program, people that are trained into becoming part of our health committee and becoming advocates in their communities across Minnesota. So there are tools available, but it is really a big uphill battle.
Thank you so much, Ryan. I've got a question from Akani2 from the chat. Doctor, what can you tell us about rural maternity hospitals closing in Minnesota?
Well, there's certain areas that are defined by some March of Dimes data as maternity care deserts in Northwest and Southeast Minnesota, but I'm not aware of specific rural maternity closures, at least in the most recent year, and so that's not. I'm not aware of anything actively, happening, but that is certainly something that we're really concerned about, given the changes in funding to Medicaid and how our providers will experience that.
Thank you so much. So, as you mentioned earlier, Dr. Nate, the insurance program Medicaid has been providing health coverage for low-income individuals for about 60 years now, and now it's facing the largest reduction in its history. This is sure to impact our state in innumerable ways. Doctor, are you aware of how many immigrants in Minnesota could lose their health coverage due to the cuts?
So we haven't been able to complete the analysis. We are looking at a number of impacts across different demographics, and so we'll be looking at each provision and how it might impact folks by things like immigration status, gender, race, ethnicity, geography, but that will take some time. And so, the best estimates that we have right now are those broader ones provided by KFF of roughly 140,000 Minnesotans could lose coverage.
Thank you, Doctor. Ryan, back over to you. I'm curious. It's been difficult for a lot of Latinos to navigate all of these rapidly changing policies from Washington right now. I guess, how is Copal helping community members navigate these changes to Medicaid?
Yeah.
What sessions are you leading?
And one thing is that we have a worker center where there's regular classes and presentations, and there's really intentional conversations happening. We know people are affected differently based on your status and other pieces, but I just want to elevate one group, which is mixed status families. And one thing we've been hearing even before these changes is U.S. citizens that are scared to apply for programs because they're scared they're going to put their family on a list. They're scared that the government will have their family's data, and then the government will go after them and their family. And that was already a problem before everything happening, but now with the increasing rhetoric of fear from the administration, with these legal changes that are adding more requirements to public programs and stripping people's rights away to access programs, people are concerned about that. People are concerned about the public charge, which is this idea that I'm going to rack up a public debt, and if I want to become a citizen one day, I'm going to have to pay that back, and it's going to be a penalty against me. And these are all factors that are happening, and again, everyone's case is different, but it's really important that we're creating these spaces through the Worker Center, through the committees, by going to churches, to schools, and having presentations, and working with partners to inform them as well.
Dr. Tromolo, I guess, what would you want to say to these people who are extremely concerned for their, safety and concern?
Yeah, I think, and unfortunately, the published literature about what happens when you restrict healthcare coverage for adults, how it impacts kids is well known. And there's actually what's called the welcome mat effect, where we saw this with the expansion of Medicaid through the Affordable Care Act. The more adults that got coverage, more kids got coverage because parents were then aware, or caregivers were aware. And so it's a real concern that we'll see the opposite as well. And I think, I think Ryan's appropriately said, a lot of the times this is a real individual instance. And so I think that the guidance, that we've kind of talked about throughout is, telling folks as much as we know about how much we can and can't protect pieces of data and information and the policies that might impact. And what is that risk that exists? The benefit being that if someone needs to get healthcare coverage because they have a condition that could actually take them from their family or their community much sooner than an immigration process, that be balanced there, and that we not try to make that decision for them. That we do our best to say, here's what's available. Here are what we can and can't control. And help folks, have the information they need to make, the assessment for them and their family. But it's hard. It's hard because that is even shifting as, we speak here and what we thought was data and practices that are safe at the beginning of this year. We've already seen some shift in interpretation from our federal partners. And so that's something that we really do need our community organizations to be telling us what they hear, what the questions are, and working together to help get that information out.
Looks like I've got a question in chat real quick. This one's a bit longer, so give me 1 second. This chatter is asking, state and federal resources often refer folks to apply for private marketplace plans when not eligible for Medicaid or Medicare due to their immigration status. In practice, most private plans will not allow applicants without Social Security numbers. Are you aware of any other options besides FQHCs for folks that are undocumented?
So FQHCs are federally qualified health centers, and those are community health centers that get federal funding. There are community health centers, free clinics that don't get federal funding. They're less frequent. They're not, and they're not as I guess well advertised. It's hard. They're not as like of a central place to find them, but they do exist in our state. But yeah, unfortunately, there isn't a lot of other well-known options for folks who don't have documented status. Unless you have an emergent life-threatening condition, and then you can get coverage at facilities, and they can help you sign up for what's called emergency medical assistance, which folks, again, who say you are about to have your appendix, burst and need a surgery, or you're having issues with kidney conditions or things like life-threatening things like certain types of cancers and stuff, you can get coverage through emergency medical assistance. But short of that, there are limited options, unfortunately.
I want to speak for a second into aspirational public policy, but a lot of immigrants have an ITIN number instead of a social security number, and that's a number that was developed in the 90s by the IRS to say, you're an immigrant, we want you to pay your taxes, you're not going to get all the benefits, but you're not going to get almost any of the benefits, but we want you to still pay in and pay your taxes and be a good member of society. And so many immigrants pay taxes with their ITIN number. Minnesota generates $222 million in state and local taxes via undocumented taxpayers. And in terms of aspirational policy, we have this great program, which is MinnesotaCare. If someone could buy into MinnesotaCare using their ITIN number, we would create a lot more access for people. So they're stepping stones. We believe healthcare is a human right, and we got to get there. But especially if you're an ITIN taxpayer, you have a number, you have a status, through your tax paying, let's make sure you can buy into MinnesotaCare and gain access for yourself, because otherwise the taxpayers are footing the bill anyway. Mm-hmm. If you have to go and you have to get an emergency care, that's coming out. Corporation is not footing the bill. The taxpayer is footing the bill.
Yeah. Correct me if I'm wrong, but isn't it more expensive for people to just go in for emergency services rather than receiving standard preventative care too?
Yeah, there's a lot of documented evidence of that, and that if you can prevent something by helping folks stay healthy, avoid complications from things that could have been caught with a cancer screening, avoid complications of uncontrolled diabetes or high blood pressure or heart disease or asthma. There's a lot of benefit both to the health, the finances of the hospital and our healthcare system, broadly within society, as far as productivity. There's really strong evidence, particularly around children, where we know that children who are covered under Medicaid throughout birth to age 18 compared to children who don't have any insurance, they're more likely to get the recommended checkups and immunizations. They're more likely to miss less school, more likely to graduate, more likely to attend college, and more likely to not require any public assistance and pay more in taxes, right? And in fact, the Congressional Budget Office actually did an analysis of that kind of 10-year window of the impact of Medicaid on children, and found that for every dollar that is paid, over half of that comes back to the federal government in improved outcomes for our citizens. And so that's where some of the moves that have been made here go in face of this kind of idea of trying to get rid of waste, fraud, and abuse, because this doesn't address any of that.
I just want to make sure that everyone understood that very clearly. You're saying that effectively it is just cheaper to give people health care services rather than wait for them to have an appendix go boom. Yeah.
I would say there's a lot of evidence. There's these kind of broad, sweeping statements. As a kind of scientist of sorts, it's hard to kind of get behind those. But a lot of evidence that when you look across populations, like the benefit there definitely outweighs the risk.
Thank you so much. I've got a question from Akani 2 one more time. Yeah. Thank you. Looks like they're asking, can you switch Medicaid providers if you have a medical condition, even though enrollment time is passed? Has passed.
So a lot of terms in medicine and healthcare, right? So a Medicaid provider, I'm assuming, is getting at like your insurance or your managed care organization. because as a provider myself, I don't have patients assigned to me by Medicaid. So I'm assuming, I'm going to just make that kind of clear. This is an assumption that we're talking about like health plans. And there is stipulations of if you want to switch your health plan, and if your provider that you're currently seeing and you want to go to a different provider and they only are covered by certain health plans, that might be one reason. But you can do that, I believe, every 6 months. If needed. So there is some kind of guidelines around that. Certainly talk to your health insurance plan or your county if you're interested in trying to switch your health plan so that you can see different providers.
Thank you so much, Dr. Tremolo. Real quick, we're about halfway through our broadcast, and I want to thank everyone so much for joining us today for our Sahan Live. Today, we're talking about Medicaid changes with Ryan Perez, organizing director at Copal, Minnesota, and medical director for the state of Minnesota's Medicaid and MinnesotaCare programs, Dr. Nathan Chomolo. And we want to know from you, what questions do you have about the changes? Of course, feel free to offer those in chat. I'll be happy to read them through. Speak of the devil, I've got another question, this time from, I want to say their name is pronounced Breestar9. What is the timeline for the Big Beautiful Bill enacted? And how is Minnesota and Copal getting ahead of this to be prepared? There's a couple more, but we'll get into those after we answer the first part.
Yeah, so that's a great question. I think that expresses some of the challenges that we are going to have and the importance of having this conversation now. And as we were talking a little bit before, we might need to have ongoing conversations as some of these provisions hit, because it was, I think, intentionally on part of the supporters of this bill put in place that some of these provisions don't actually, most of them actually don't hit till starting in 2026, some in 2027, and some in 2028, or in even some beyond that in 2029. So I think as each of these provisions are starting to go into effect, it's going to be important that we're coming back to the community and saying, hey, coming up, you might have to go start submitting your work documentation, and because work requirements are going to be in place. Coming up, you no longer will have what we call retroactive coverage, where once you sign up for it, right now, Medicaid would cover your bills for the 3 months prior to you signing up. That's going to be decreased to 1 month for most people, some folks 2 months. And so those are some pretty big, changes and shifts in how we've operated Medicaid historically, how people have experienced it. And so it will be incumbent upon us, and that we certainly are aware and working on a plan to work with our community organizations like Copal to let them know this is what we're interpreting, this is what we're planning on rolling out, and then helping make sure we engage communities around that as well.
Yeah. I mean, what I'll add is the staggered timeline of all the different pieces of this law is, if it seems confusing and it seems like bad policy, that's because it is confusing and it is bad policy. And there are political reasons to make it confusing and to make you unsure of when these changes are going to hit, and to make it unclear in 2 years when we have a different economy and we have a different cycle of where we're at as a country, when we start feeling different effects. And so, again, it's a really important time for community education. But also, I just want to stress that in addition to all the fear people are facing, uncertainty, when you hear fear and uncertainty, this is a lot of uncertainty, because you're trying to plan around your life, your access to programs, the affordability of your life month to month, and your access to healthcare, your access to insulin, and then suddenly you have to plan around these dates and start thinking. It's just really confusing, and it's not helpful for people.
Ryan, earlier this year, we saw the Minnesota legislature take away MinnesotaCare coverage for undocumented immigrants. Now, I'm curious if Copal or anyone else is trying to start an effort to get health coverage back for undocumented adults at the Capitol. Have you been seeing anything?
Yeah, definitely. I mean, the whiplash of it being expanded, acknowledging all the contributions of immigrants to our state, and then being taken away so quickly. Immigrants are continually used as a bargaining chip when times are tough at the state legislature, and we fully expected that some of our wins would be chipped away at. And this is a pretty bad one. There's a lot of efforts by partners, definitely, to push for restoration, but Copal is part of the Minnesota Healthcare for All Coalition, and we are focusing on a Minnesota health plan, starting with a buy-in option for MinnesotaCare, And we think that is one pathway to start restoring access for people to this healthcare system.
Thank you so much, Ryan. I'm sorry, I'm just taking your laptop. I've got my cohort right over here next to me. Another question from Bree Star. How will this bill affect disabled Minnesotans, especially those who cannot work?
Yeah, so in the bill, there are stipulations for folks who have to complete the work requirements. And so it's the work requirements are going to be enforced on basis of eligibility. And so it's for adults under the expansion population, which is the term for the affordable folks who get coverage through the Affordable Care Act. So it's not applied to everyone. And then within that, there are stipulations for things like disability diagnoses, parents and children. So we are awaiting guidance from the federal agency CMS that will tell us exactly, how they are going to expect us to implement it. And we've been told that guidance could come as late as next spring. And so we have we're also kind of waiting to see exactly how that is going to impact so that we can do some of those estimates so that, again, that we can come back to spaces like this and share those updates once we have that information. We know, again, historically from where these work requirement policies have been implemented before, that even if you put all this language in that's saying folks with disabilities are exempt, that folks, that mothers and parents and fathers are exempt, that our systems aren't perfect, right? And folks who should have an exemption aren't going to be showing up as an exemption and will likely then lose coverage. And that, is something that is a reality of this policy. It is a bad policy. There's lots of documentation to that effect. I feel very comfortable saying that we're going to be wasting money that could be going to helping care for folks to implement this policy. And so that is the real concern. And so certainly if you have folks in your life who get their coverage through Medicaid who are navigating disability, it will be something to keep a close eye on. The work requirements have to be in effect starting in January 2027, unless states are granted exemptions. And so that is the kind of date to be aware of when you're thinking specifically about work requirements.
So we know that all these changes are going to be these changes to Medicaid are going to be happening as early as next year, and then so on and so forth in waves. How can people find out if they lost health insurance or health coverage?
Yeah, so the first thing is if you currently have health insurance and you're getting it through a health plan, like think about your kind of Hennepin Health, Medica, UCare, call them and can verify whether you're still covered or not. If you have gone through the county to sign up for health care coverage, they should also have information on whether you're eligible and when you need to renew. So I think renewal is certainly something that we are continuing to remind folks about. Because historically we've seen folks who are eligible lose track of that renewal process and then lose coverage even before this bill was passed. And so this is an opportunity to kind of remind folks to just be aware of making sure that you're turning in your forms and keeping coverage that way as well. But I think those would be the kind of two main ways if you currently have coverage to kind of ensure that you're aware of when you might lose it. And again, a lot of these provisions don't start till 2026. So we don't expect anyone because of this bill to be losing coverage this calendar year, but it's, again, something we want to be following pretty closely.
So this goes for both of you. I want to hear both of your recommendations. This is from chat from Yoko Vu. How can we help our parents/young family members who are on Medicaid? What services or at least compassions can we provide them as individuals, I guess?
One piece of this, it comes with all of these attacks on people right now through new legislation. There are huge mental health impacts affecting the community. Copal right now is exploring building out more mental health programming, mind-body medicine, different avenues for how can we create spaces of healing when everything in the news cycle. Imagine on top of, there's very practical challenges with you losing access and your conditions changing. But there's a whole nother element when the people on the news, the faces on the news are talking about you. They're talking about the program that you have access to, and they're talking about cutting it, and they're talking about you as an enemy, as a leech, as taking from a system. these are really scary, and these are also, they have huge mental health impacts. And so my point is that there's a lot of community organizations that provide amazing health programming, especially mental health programming. It's important to create these cultural spaces, these healing spaces, and people can call. A starting place is always Copal's Navigators Helpline, as well as our website, www.copalmn.org.
Yeah, and second all of that, and it would add that a lot of policy is driven by narrative, right? And it's driven by the kind of ideas that we are told and socialized over years and years. And so if you have people in your family that have Medicaid, kind of sharing that story with other people in your community, sharing that story in places that you feel comfortable, where people who are civically engaged, politically engaged, can then share. So whether that's talking to your representatives, that's talking to your employer about the impact that it has, that you're worried about your family. And the impact that might have on you and your role there. We are trying to help facilitate some of that narrative change through a website that we started called The Faces of Medicaid, where folks can go and submit a picture and a story about the impact Medicaid has on them or their family member or their community member, and then having that there available for folks to see and have decision makers really, again, have some of these numbers we've thrown around are like super big, trillions of dollars. How do you wrap your mind around that? But when we say that it's actually someone that looks a lot like my cousin or someone I worship with or someone I work with, and you can see that similarity, I think that can help bring it home, and so that we actually end up with policy that reflects a lot of the values that we in Minnesota say we share about caring for each other.
I want to make sure that everyone's working with the same information right now. Could you define what the changes in eligibility are for us real quick?
There's a number of them, right? And so I think some of the ones folks should be most aware of is we talked about the work requirements. So again, that's for folks, adults who get their coverage through the Expansion or Affordable Care Act. There are changes in lawfully present status that impact certain folks who might have historically gotten coverage, asylum seekers, victims of torture and domestic abuse, who no longer will be considered eligible for Medicaid as well. And then there is a certain criteria around how often we ask folks to prove their eligibility. It's called redeterminations that we were talking about. Currently, for most people, it's like once a year. They're going to increase that for, again, that same population of folks who get it through the expansion to every 6 months that you'll be having to submit that. But again, all of these, the earliest any of those policies go into place would be 2026.
I'm going to pivot on the conversation a little bit. So in 2023, the Minnesota legislature passed the MinnesotaCare Immigrant Inclusion Act, which allowed undocumented residents to access healthcare coverage through MinnesotaCare. MinnesotaCare is the state program that provides coverage for low-income residents. The program is operated by the Minnesota Department of Human Services. But this June, the Minnesota legislature voted to eliminate MinnesotaCare for over 15,000 undocumented adults starting in 2026. Dr. Tromolo, can you tell us why these changes are happening?
Well, as you noted, it's the legislature that made this decision. And since I'm not a legislator, I can't, comment on exactly the reasons. As a private citizen, I will echo that I saw a lot of what Ryan was talking about the conversation being one of dehumanization, I'll just call it, of our undocumented citizens, our neighbors and friends. And so unfortunately, in the process of deciding on a budget, that policy is one that made it through. And so, as far as the policy itself, it was the mandated changes took effect in June 15th of 2025. And so if someone had enrolled as an adult before then and told that they are given coverage, they'll have coverage until the end of this year, till December 31st. But as of June 15th, folks who are over the age of 18 cannot get coverage if they're undocumented through that program. Children can continue to get coverage. up until the month after their 18th birthday, that they'll be able to get coverage. And so we are going to continue to working with communities to let them know that is an important thing that we're able to continue to do, and then can continue to work alongside our community members to lift up the value of having healthcare access for everyone in our communities, and how we all benefit when we take care of each other, helping our legislators hopefully make better decisions around that in the future.
Ryan, I want to hear from you. Well, I want to hear what you're hearing from other people. What have undocumented community members said about the recent changes to MinnesotaCare?
Yeah. Again, I'll stress that it was going to be so much work. It already was so much work, and it was going to continue being so much work to even get people informed about this new access in the first place, to make sure people know that the law had changed and we had won these new benefits that we deserve like everybody else. But now there's new education to undo and unlearn that, and to say, well, it's actually been taken away because our people were the first on the chopping block in a legislative compromise that immigrant rights were bargained away. And so for a lot of people that have been watching and have been paying attention, it's very infuriating. It seems like there have been false promises that were made and then taken away. And it should inspire people to get engaged and to be vocal, and to track that this is a bipartisan problem, that we don't have access to healthcare. It's a bipartisan problem that immigrant rights are not being prioritized. And we need to make sure legislators on all sides of the aisle, decision makers on all sides of the aisle, are well informed, and that our narrative humanizes immigrants. And it was really exciting to hear from Dr. Chamalo about the faces of people, faces of Medicaid, because that's exactly it. It's like, these are people, these are your coworkers, these are your friends, these are your people you go to church with or worship with. And so we need to be 100%, humanizing this issue, that these are impacted people.
Thank you, Ryan. I'm curious if you're able to share some of the stories that you've heard from these people. Like, I'm not sure what they've been saying to you, if anything.
Yeah, again, there's the biggest thing that we hear time and time again, and I talk to people who were just, even when they find out they're eligible for a program, there's just so much fear. There's so much fear to apply. That fear was there before. It's even more fear now when they say, well, will the Trump administration have my data? Will ICE come after my family? So there's just a lot of fear. And there's among our leaders and our members who are super highly engaged through our committees, they're kind of ready to fight. They're ready to put up a fight and to say, we got to win back our rights. And that's across the board. It's healthcare, it's immigration, it's many issues.
Thank you so much, Ryan. Thank you for sharing. If you are just now joining us, hi, my name is Alberto. You're listening to Sahan Live. We're here with Ryan Perez, the organizing director at Copal, Minnesota, and Dr. Nathan Chomalo, medical director for the state of Minnesota's Medicaid and MinnesotaCare programs. Ryan just shared what he's been hearing from undocumented community members that will lose their health coverage in 2026 due to the elimination of MinnesotaCare for undocumented adults. However, if I'm correct, children, you said, will still have coverage until the age of 18 and 1 month after. Correct, Doctor?
Yep, that's correct.
I guess you've heard from Ryan speak about concerns from community members, but what will undocumented adults lose with this coverage, or without this coverage? What services will they no longer have access to?
Yeah, so MinnesotaCare is a great benefit set. When you look at what we've, in one little maybe historical detour here is MinnesotaCare is a bipartisan program. It came out of bipartisan efforts in the 90s, recognizing that Medicaid wasn't doing enough to help all working Minnesotans who might not make enough money to afford insurance on the private market, and they didn't get it through their employer. And so it really was a preamble to what we call now the Affordable Care Act, or Obamacare, in that the bipartisan leaders from both sides of the aisle came together to create MinnesotaCare. And so it provides all the things that Medicaid does, which is a comprehensive benefit for primary care, access to dental care, access to physical therapy, occupational therapy, psychotherapy or mental health care, benefits like access to transportation and assistance and ways to actually get to appointments and get the care you need through interpreter services, things like that. And so, I haven't met directly with folks, impacted, but I've heard from other community organizers that when folks got this coverage, they were getting things like needed procedures for their heart, knee replacements so that they could continue kind of working and being active in community. They were getting caught up on things like immunizations. And so, this is the type of care that now will be likely foregone in many instances until it's absolutely critical or necessary. Again, costing us all. Not just folks in the communities who don't have access to care, but all of us will end up having to pay more because we're not providing this care in a way that values everyone's presence in our community.
If I can add on, Latinos are the number one uninsured and underinsured block of people in this country. In addition, I'm Puerto Rican. There's data that says 1 in 3 Puerto Ricans is diabetic. And that statistics, if I think about cousins and family, that statistic holds up. People have, regular medication needs. They have a chance to either get better or to decline. And it's just really scary the impacts this is going to have. And it's not felt equitably. And it affects different people based on race, ethnicity, gender, class, and all. And we have to be really conscious of who we're leaving out when healthcare, and the context, the historical context was great. Because healthcare historically in Minnesota is a value. And so let's keep it a value and let's make it a value for everybody.
I guess, Ryan, as you talk to people who are, like you're saying, disproportionately uninsured or underinsured, what advice are you giving them?
Yeah. Well, my title is Director of Organizing, and so my call to action is we got to organize for it. We got to fight for it. Yes, there's health programs. Yes, we connect people with resources in the short term, but in the long term, healthcare is such a big issue. It requires intervention from the state. It requires policy change at the federal level. It's a really key thing that we're organizing around elected officials, around understanding strong public policy, and as well as the vote and making sure that's an.
Oh, sorry, keep going.
No, yeah, that's it. I said my piece.
Continuing, going back to the short-term, I guess, goals and gains, is Copal working with any free or reduced care clinics to help those who will lose coverage next year?
Definitely. I don't have the names at the top of my head, but our health and wellness team, which includes amazing health promoters, they are just always connecting with local community organizations, doing pop-ups, and then what our health team does really effectively is might bring Spanish language access into a space that otherwise doesn't have it and make spaces overall more accessible.
I'm going to give a quick shout out to the Phillips Neighborhood Clinic. That's the one that I can remember off the top of my head that a couple friends used to work at, free healthcare services. Granted, I think they're only open 2 days a week, which
I actually used to precept there, and it's through the University of Minnesota, and they work with medical students, with nursing students, with dental students, physical therapy students, and then usually connect folks through things like the Community University Healthcare Center, or CUC, in the Phillips neighborhood as well.
La Clínica is another amazing resource.
Can I ask what these clinics offer? Does that make sense? It's a broad question, I know.
Yeah, it vary widely. So if you're just talking about like free small clinics like the Phillips Neighborhood Clinic, they usually do basic screenings. They can do kind of initial physical exams and kind of referrals. They can even do some prescriptions, but they don't give you obviously the coverage to go then get that paid for. But they can give you the script to go find a pharmacy that you can work with. And then when you go all the way up to like the community health centers or the federally qualified health centers, they are really a model of care that I think exemplifies what I hope our healthcare system can somehow reach, where you can go there and you get physical healthcare, behavioral healthcare, dental care. They often have folks that help you navigate our social safety net. So if you are experiencing issues with food insecurity and need food or meals, they often have things like food shelves or directions to get to food shelves. They have things like some have legal assistance, some have housing assistance as well. And so our federally qualified health centers are really a great model, and they're governed, I will note, by the community as well. Their boards are made up of 51% of folks that they serve. So it's really a great model, and utilizing them when you can is a really great option.
Thank you so much, Doctor. We're reaching the end of our broadcast. We've got about 7 minutes left to go. Thank you so much for joining us today for our deep conversation on Medicaid and MinnesotaCare and the coverage and the changes to its coverage. Today, I have Ryan Perez, the organizing director at Gopal, Minnesota, and Dr. Nathan Chomelo. Hold on, I've got your title right over here. The medical director of the state of Minnesota's Medicaid and MinnesotaCare programs. If you have any questions regarding the changes to Medicaid and MinnesotaCare, please feel free to drop those in the chat. We've got about 5 minutes, and we would love to answer as many things as we can. On the topic of answering as many things as we can, Dr. Chomelo, how should undocumented adults prepare for the next year? What steps can they take right now?
Yeah, I mean, I think it will depend if they have coverage, right, or not. Certainly, we've listed a number of things for folks who don't currently have coverage, and again, connecting with organizations, whether it's like Copal or other organizations that kind of identify and reflect your culture and language. Certainly amongst those that are going to transition from having access to healthcare through something like MinnesotaCare to not, being aware of things like emergency medical assistance and when that might be apply and when you're eligible for that, knowing that there are certain conditions like or stages of life, I would say. So if you're a pregnant woman or birthing person, you are eligible for assistance, no matter your immigration status, depending on your income level. So that is one instance of being aware of different conditions and folks in your community that might be able to access care that aren't currently. And then thinking again about where are those other, whether the free community health centers, the free clinics or the community health centers, the federally qualified health centers, where those are, and how to get connected to them, and understand some of the federally qualified health centers have a sliding scale, and so they might require or ask that you pay what you can, and so you can then talk to them about that and budget appropriately. Those are some of the steps that you can take.
Thank you. Looks like I've got a question from chat. This question comes from Rosie Thale. What can individuals do to get involved and fight back against these changes?
Yeah, shout out to Rosie. Thanks for that question. The biggest thing is to connect with organizations that are part of this movement for access to healthcare. There are so many out there. Copal is a great one to start. We have, obviously, I'm going to say that.
Self-plug.
Obviously, it's really good. But Copal is good in the sense that if you are Latino identifying especially, or you're part of a Spanish-speaking community, or you're connected and you know your neighbors and you want to support as an ally, those are all really good reasons to get involved with Copal, get involved in the organizing for policy change, getting involved in connecting and understanding what's coming down the pipeline. And also the geography is touched, that if you're in South Central or Southeast Minnesota, as well as the Metro, we're a plug-in point. But there are just amazing healthcare organizations out there. Again, we're part of the Minnesota Healthcare for All Coalition. We also know people who get involved with like the Minnesota Nurses Association, or get involved with many other political action groups that are really fighting for people to restore and expand access to healthcare.
Thank you so much, Ryan. Looks like we have reached the end of our broadcast. I want to thank everyone so much for joining us tonight. Thank you so much to both of our amazing guests, Ryan Perez, Organizing Director at Copal, Minnesota, and Dr. Nathan Chomelo, Medical Director for the state of Minnesota's Medicaid and MinnesotaCare programs. Before I start our sign-off, is there anything that either of you two would like to add?
Yeah, I just want to kind of lift up that I think the core to some of the things we're talking about is that piece of dehumanization. And so, as someone who grew up biracial Black, son of immigrants, I've seen how dehumanization can really play out in bad ways and horrible ways, and I'm really worried about that repeating a number of ways in our communities here now. And so, really thinking about how we could see the commonalities amongst each other, how if we see others, even if it doesn't impact us directly, that we are learning to see these impacts, stand up and say something, because eventually it will impact us all. And we see that in this bill. The federal government is walking away from its long-term commitments to Medicaid, and as a result, our state's going to have to make tough choices and deep cuts because of these changes in federal funding, and this is going to impact our ability to do other types of care. We might not even just only have to make changes to our Medicaid program. We might have to start changing how we fund things like schools and roads and other things like that as a result of this. And so, we're all really impacted by this, and we need to see the humanity in all of each to really put forth a vision for ourselves, our kids, of the Minnesota that we want.
And healthcare is a human right, and we all do better when we all do better.
You're right. Of course, like you're saying, eventually an inch becomes a mile. These things become compounding issues. Thank you both so much for giving all of us an hour of your time. We're gonna have a full conversation. We're gonna have the full conversation available for you on our YouTube after the live ends. Also, we're gonna have a highlight article recapping major takeaways from this conversation posted to our website probably later this week. Of course, with that, snippets of this conversation will be posted on across our socials. And make sure to stay up to date with the latest news impacting immigrants and communities of color in Minnesota at sahanjournal.com. Thank you so much for joining us today, everyone. I hope you all have a wonderful night.
Stay safe. Thanks, Alberto. Thanks, Ryan.
Thanks so much.